Alcohol use disorder is a major health challenge affecting millions of people worldwide. For decades, we've been searching for effective ways to help people achieve and maintain sobriety. Let's dive deep into one of the oldest and most fascinating tools in the fight against alcohol dependence, a medication called Disulfiram, maybe better known by its brand name, Antabuse. This drug works in a way that's completely different from most modern treatments, and it has a pretty interesting history. So, what is it? How does it work? And does it still have a place in recovery today? Let's find out. Disulfiram was first approved way back in the 1950s, making it a pioneer in the medical treatment of alcoholism. But its story starts even earlier, in factories where workers exposed to certain chemicals found they got violently sick if they had a drink after their shift. Scientists investigated and discovered a compound that dramatically interfered with how the body processes alcohol. This led to the development of disulfiram. Unlike many modern medications that work on brain chemistry to reduce cravings, disulfiram is what's known as an aversive agent. Its job isn't to make you want alcohol less. Its job is to make drinking an incredibly unpleasant experience. It acts as a powerful physical deterrent, essentially creating a consequence that helps reinforce a person's decision to stay sober. It's designed for people who are already motivated to quit and need an extra layer of support to prevent a relapse. So, how does it create this unpleasant reaction? It all comes down to biochemistry. When you drink alcohol, your liver breaks it down in a two-step process. First, an enzyme called ADH turns alcohol into a toxic compound called acetaldehyde. This is the stuff that gives you that flushed feeling, headache, and nausea associated with a hangover. Normally, your body quickly gets rid of it. Another enzyme called ALD swoops in and converts that toxic acetaldehyde into a harmless substance called acetate. This is where disulfiram steps in. It blocks that second enzyme, ALDA. So when someone taking disulfiram drinks alcohol, that toxic acetaldehyde can't be broken down. It builds up in the body, reaching levels 5 to 10 times higher than normal. The result is a severe reaction, often called the disulfiram alcohol reaction, or DARE. Within minutes of consuming even a small amount of alcohol, a person can experience intense facial flushing, a throbbing headache, heart palpitations, severe nausea, and profuse sweating. In more serious cases, it can even cause dangerously low blood pressure. The reaction is so immediate and unpleasant that it creates a strong deterrent against drinking. One of the most unique things about disulfiram is how long it stays in your system. Its effects can last for up to 2 weeks after you take the last pill. This means you can't just skip a dose for a day to have a drink. This long-lasting effect creates a psychological safety net. Even a tiny amount of alcohol, like what you might find in some mouthwashes, vinegars, or even aftershaves, can trigger a mild reaction. This forces a person to be constantly mindful of their sobriety, which can be a powerful tool, especially in early recovery. Because of the potential for a severe reaction, disulfiram is a prescription-only medication and is only given under medical supervision. It's not for everyone. Doctors typically recommend it for individuals who are highly motivated to stay abstinent and have a strong support system, like family or a structured treatment program. It's not suitable for people who are still actively drinking, have certain heart conditions, or are pregnant. A person must be sober for at least 12 hours before starting the medication. The dosage is carefully managed by a clinician, usually starting with a higher dose to build it up in your system, followed by a lower daily maintenance dose. One of the keys to its success is adherence. The medication only works if you take it. That's why supervised dosing, where a healthcare provider, therapist, or even a trusted family member watches the person take their pill, dramatically increases its effectiveness. So, how effective is it really? Well, studies have shown that when it's used in a supervised setting with motivated individuals, disulfiram can lead to significantly higher rates of abstinence compared to no medication. It's particularly good at reducing episodes of heavy drinking. The fear of that nasty reaction is a powerful psychological barrier that helps people resist the impulse to drink. But its success really hinges on the person's commitment. If someone decides to stop taking it, its protective effect is gone. Even with newer medications available, Disulfiram still has some distinct advantages. First, that strong deterrent effect is hard to beat. It provides a clear, immediate consequence for drinking. Second, it's been around for over 70 years, so we have a very good understanding of its safety profile and how it works for different people. Third, it's very cost-effective, making it accessible to a wider range of patients. And finally, it works incredibly well when combined with behavioral therapies like counseling, support groups, and 12-step programs. It's the physical component that reinforces the psychological work being done in therapy. Of course, Disulfiram isn't a magic bullet and it has its limitations. The biggest one is that it doesn't do anything to reduce the underlying cravings for alcohol. Medications like Naltrexone or Acamprosate work on the brain's reward pathways, but Disulfiram doesn't. Its success relies almost entirely on the person's willpower to take the pill every day. There are also potential side effects, which can include tiredness, a metallic taste in the mouth, and sometimes skin rashes. More serious liver complications are rare but possible, which is why regular check-ins with a doctor are essential. Patients also have to be very careful to avoid hidden sources of alcohol in food and other products, which can feel restrictive. So, how does Disulfiram stack up against the other FDA-approved medications for alcohol use disorder? Naltrexone works by blocking the pleasurable effects of alcohol and reducing cravings. Acamprosate helps to stabilize the brain chemistry that gets disrupted by long-term drinking. Disulfiram is different. It's the consequence medication. It's often best for people who are committed to a strict abstinence-only approach and want that external backup. We see it used a lot in court-mandated programs for DUIs, for example, because adherence can be monitored. It's also used by professionals in safety-sensitive jobs, like pilots or surgeons, who need to guarantee their sobriety. And for individuals in early recovery who are terrified of relapsing, it can provide a huge sense of security. Beyond the biochemistry, the psychological impact of Disulfiram is huge. Many people who use it describe it as a safety net or a way to regain control. The fear of the reaction becomes stronger than the temptation to drink. It's a classic example of conditioned avoidance. You learn to avoid a behavior because you associate it with a very negative outcome. So what's the future for this old-school medication? Researchers are always looking for ways to improve treatment. In some countries, they're experimenting with long-acting Disulfiram implants that would remove the need for a daily pill, though these aren't widely approved yet. Telehealth is also making supervised dosing easier and more accessible. In the end, Disulfiram is a powerful and unique tool in the world of addiction treatment. It's not for everyone, and it's certainly not a standalone cure. But for the right person, in the right situation, someone who is motivated, has good support, and is part of a comprehensive recovery program, it can be an incredibly effective way to reinforce their commitment to a sober life. It's a testament to the idea that sometimes the simplest mechanisms can have the most profound impact. Thanks for watching. If you or someone you know is struggling with alcohol use, please know that help is available and recovery is possible. Don't forget to like this video and subscribe for more content. See you next time. The information provided in this video is for educational purposes only and should not be considered medical advice. Individuals should consult a qualified healthcare professional before starting or stopping any medication related to alcohol use.